ladies and gentlemen, the second wave of coronavirus has hit humanity hard. The mutant strain spreading like wildfire is now showing enough indications of affecting our children. Not just in India, this development has been noticed in several countries in different parts of the world. What's alarming is that at least 3 states in India have shown a worrying pattern of kids getting infected. In the past 2 months alone, Karnataka has approximately seen infected children up to about 40,000 below the 9-year age mark. And these have been infected by the virus. In fact, in one hospital in Delhi alone, they have seen several times more cases of children in comparison to the first wave. In Uttarakhand, 10,000 children below the age of 9 years have been infected. The Prime Minister has called on the government task force and scientists to study the strain affecting these children and its severity. So, ladies and gentlemen, the legitimate question on the show tonight: how do we keep our children safe? And joining me on the other side are 2 experts who'll take us through what we need to do.
You're watching the News Hour at 9, debate number 2 on Times Now, Super Prime Time.
And joining me tonight is Rajib Dasgupta, member of the COVID Task Force. Also joining me tonight is Dr Anupam Sibal, Group Medical Director and Senior Pediatrician of Apollo Hospitals. Both of you, thank you for joining me on the News Hour tonight. Rajib Dasgupta, I want to ask you, is there something specific in this strain of the COVID that we're seeing with an increased impact on children below the age of 9 years? Because these are a segment of vulnerable population, because so far we don't even have results of any impacts of vaccinations on children. How do we look at this entire spread of virus, at least in three states of Karnataka, Uttarakhand and Delhi?
Thank you. The 2 prevailing strains, or at least 2 of the prevailing strains, the UK strain and the B1617, which also has 3 subtypes now, or sublineages identified, seem to be at least 30 to 50% or perhaps even more transmissible than the previous strain that we experienced in the first wave. That really has meant an exponential increase in cases across age groups. The US experience is, and there's a lesson there because the numbers are reasonably comparable. Till now, they have nearly 4 million pediatric cases. And one of the reasons that the infection is seemingly spreading higher in children are 2. One, that children were protected in the earlier phases because of the lockdown and so on, and it's the adults who were more exposed. And now, because the strains are more highly transmissible, the spread within the family, or what in our jargon is called the secondary attack rate, is much higher than the first wave, and therefore a much larger number of children are getting involved, and we are clinically seeing them in hospitals or in clinics. So in the US experience, the cumulative proportion of pediatric cases are 14% cumulative, but in the newer or more recent cohorts, it's nearly 24% across some of the states. So that's the magnitude we are probably heading to, as more and more adults are experiencing the infection and therefore won't be as susceptible as children. And one last thing, the experience also from other countries is, compared to those children who are attending schools, which in our case they weren't mostly, except the class 10, class 12 group, more children are falling ill if they attended any other indoor event rather than playing outdoor with other children. That broadly is the epidemiological picture.
Well, Anupam Sibal, Dr. Anupam Sibal, have you seen the incidence rising in terms of the patients that you receive in Apollo hospitals? And what is the treatment? How is this preventable? From the point of view of Rajib Dasgupta, outdoors at this point is better because indoors, ventilation has been seen to be somewhat of an issue in the second wave. How do we protect and keep our children safe in this second wave?
Good evening, Navika. Thank you for having me on your show. So you see, in September, our peak was 97,000. That was the highest per day. And in this wave, we've had 444,000. So when you have 4 times more infection on any given day, for example, you're going to see the vast majority of the population not being spared. And that would include children. So it stands to reason that when the numbers increase, children too will show the impact, and we will see more numbers. And that's what's happening. It's happened pan India. We have 73 hospitals. We have more than 40 facilities where we have departments of pediatrics at Apollo, and that's the trend everywhere. We are seeing more children. But let's look at the positive. The positive is, one, that the infection continues in the vast majority of children, say more than 90%, would be very mild symptoms, a little bit of fever, cold, cough. What of course we've seen in this phase is some GI manifestations of diarrhea, which we didn't see in the first phase. MISC has really been talked about too much, and I just want to dispel this myth about MISC being, quite common. Well, it's not. It's like less than 1% in those who have an RT-PCR proven COVID-19 infection. So I think let's sort of stop worrying about MISC, because every parent now asks you, if the child is diagnosed with COVID, is my child going to get MISC? And the answer is extremely rare. So let's not worry about it. Coming to your question of, clearly what we have seen in this wave is that the transmissibility is much higher. So if one individual in the family gets infected, the vast majority will. That was not the case in the first wave. So if a child gets infected, the child can pass it on to other family members, and the other way around. How do we protect our children? Of course, with all the restrictions that we have, that has clearly started showing an impact, and that impact will apply to children as well. As more and more adults get vaccinated, there will be some amount of cocooning in that families will have members who have been vaccinated, and that kind of protection is good. But of course, we cannot ignore the fact that when 36 crore Indians are less than the age of 14, 3 crores more than the entire population of the United States, and 46 crores less than 19, they will need to be vaccinated. Of course, the priority is lower because the infection doesn't have serious complications, but we will need to vaccinate children. And we're so happy now that the trials have been approved for children. And hopefully in the coming months, as the supply chain improves and we are able to vaccinate adults like we've never vaccinated before, hopefully, 5 million a day consistently over week, and then we will be in a position to be able to vaccinate children, and hopefully we will have approval under emergency.
So Rajib Dasgupta, how soon are we going to be in a situation where we can be looking at vaccinating our children? Because we've been looking at things in terms of the vulnerabilities of population, and we've obviously decided that older people above the age of 60 and then above the age of 45 more vulnerable, and especially with comorbidities. But we haven't possibly taken into account the fact that children in their growing years, are cooped up at home. They can't go to school. They can't go and play outside. And, their development, their learning, is being impacted because, frankly, it's been almost a year and a half, and we don't know when we'll see the end of this kind of restrictions. Have we delayed the trials on children? Have we somehow, put the issue of vulnerable children being or requiring vaccines out of the frame for much too long?
Well, as far as the Indian situation goes, as Dr. Sibal very rightly said, the permission has been granted for initiating the clinical trial in India. However, for other vaccines in the US, for example, those have Moderna and Pfizer, those have borne good results in children because the immune system is different, so the dosages are different. So the rules of the game are somewhat different of clinical trials of vaccines in children as compared to adults. And also because the cases are going to be much less in children. Therefore, interpreting those results also require some modifications in the methods and some other cautions. Nevertheless, the US experience with those two vaccines is that the response is good, and we hope similar results would be seen in India too. And those vaccines would be are likely to come into action by September or so, pending authorization, of course, from the FDA. So one option. So on one hand, that's the kind of time scale that's required. So our expectations should be reasonable. Plus the fact that globally more vaccines could also become available for pediatric use, either somewhat before or more or less at the same time that the Indian vaccines become available. But no country in the world really has prioritized children above other age groups. So we are in sync with that principle.
Well said. At the moment, of course, on a prayer and a hope. But Dr. Anupam Sibal, just one last point. Briefly, can you tell our viewers any precautions that we need to take when we have children below the age of 10 or 12 in the house?
Well, I think SMS is here to stay. So, sanitization, masking, very important, social distancing. When it's the turn for someone who's eligible to get vaccinated, please go ahead and get vaccinated. Very important for the parents to walk the talk. If you expect your children to behave in a COVID avoidance behavior appropriate manner, then please do that yourself. If a child gets diagnosed with COVID, please do not panic. Do not look at adult prescriptions and, decide to give 1/3 or 1/4 of the dose. Please get in touch with the pediatrician. There are 32,000 of us just part of the Indian Academy of Pediatrics and a few thousand more. So access is not an issue. The vast majority of kids will do really well, will not require anything more than paracetamol. Small proportion might need oxygen and steroids, might need other medication. Extremely unlikely for them to require medication like tocilizumab and so on. And the proportion of kids who will get MISC is very, very small. So through your program, Navika, the message is, please do not panic. Children, the immune system children reacts very differently. Unfortunately, it prevents any serious complications for happening in a significant proportion of children. And yes, we need to vaccinate them. We need to get them back to school. Their development is getting compromised. They're putting on weight. Social interactions are a big challenge. And we're getting issues with eyesight because they're on the screen all the time. So we need to get them back into a normal routine. And we are very hopeful that we will get the vaccine in a few months from now, when the vast majority of adults, of course, who are a higher priority vaccinated.
Thank you very much, Dr. Anupam Sibal, for those great tips, which I'm sure will benefit our viewers. And at the same time, I'd like to say that the Prime Minister has asked officials to examine. He's given directions that there should be a study, countrywide study, that should be done on spread of COVID in children. Also, to look at the severity. All states have been asked to submit data that can be looked at very closely in terms of studying any patterns on what to do, what not to do. And once that has been done, the fact that the vaccine trials are going on, including the Indian-made Covaxin, which is going into a trial phase for children soon, hopefully, we will have some solutions for children getting affected by COVID. Thank you very much, Dr. Anupam Sibal and Mr. Rajib Dasgupta, for joining me on the News Hour.